Hello, I'm Lisa Tyler. I'm the host of Senior Connections. This is the monthly television show brought to you by Senior Resources, which is your area agency on aging. And we come together every month to talk about things that are of interest to older adults and people who care about them. We cover a variety of topics from Medicare, Medicaid, prescriptions, safe driving, programs in the community, a variety of topics, trying to help you navigate your way around what can be a confusing network of services. So our topic today is important and timely as we are in September, which is the start of fall coming up very soon, beginning of autumn or fall, and it's also Fall Prevention Month. And so we're going to talk about this really important topic, and I'm very fortunate to have three lovely and very fun guests. Holly Alway, who is Coordinator of Injury Prevention at Mercy Health, and I'm hopefully not going to butcher names here, Dr. Josyula and Dr. Thomas, both with Mercy's Geriatrics practice. Welcome, ladies.
Thank you.
Thanks for coming. So let's learn a little bit about each one of you, what you do and what interested you in your role. Holly, we'll start with you.
Sure. Well, I'm the Injury Prevention Coordinator at Mercy Health. So in a nutshell, I like to say my job is to keep people out of the emergency room. I'd rather you stayed home and stayed safe. So what I look at in injury prevention is a variety of risk factors, and we'll talk about those risk factors today as they relate to falls. But there are things you can do with your behavior, there are safety devices, there are environmental changes, and those are the things that I work to impact to make sure that we keep our community as safe as possible.
Great. How long have you been doing that?
I have been there since 2002,
Oh,
so you can do the math.
We're not doing math.
No.
You started as a young child.
I did. I wasn't graduated yet.
Dr. Thomas, how about you? How long have you been with Mercy?
I've been with Mercy now 5 years. I just actually celebrated my 5-year anniversary. It's been an amazing journey. When I came down here, the practice was initially started by Dr. and now with myself and Dr. Josyula kind of joining, we kind of took the practice in an amazing direction where we're doing new things and trying to engage with the community and trying to connect the dots to service the patient population that we have here.
Which is increasing all the time.
Yes, certainly.
Right. Dr. Josyula?
I'm also going to have been here 5 years by the end of next month, so we came around the same time. I'm also with Mercy Geriatrics, and preventing falls is sort of bread and butter, day-to-day work, and there's so many different aspects to it, as Holly already mentioned, and so we try to impact that. We also work with our care team members, which there's a large group of, because it takes a lot to support. It takes a village to support both children and older adults.
Right.
And so we have a village at Mercy Geriatrics that we also work together to prevent falls, and we're really invested in both educating patients as well as their caregivers on how to prevent them.
Yeah. Great. Well, I'm already thinking that I'm going to have just the two of you back probably, because we could easily do multiple half hours just about the practice and how that's changed probably in the 5 years you've been here.
Oh, yeah.
Yes.
But we're not going to do that. But I'm inviting you now to come back again. So let's talk about older adults and falling. And Holly, what's the definition of a fall?
Anytime you hit the ground and it's unintentional, right? He goes out and tends to fall, but when we have any sort of unexpected impact, that's a fall. And sometimes we have injuries out of those falls, and sometimes we get lucky and nothing happens. But I think it's really important that if you start to see a series of falls in your life, or you start to have that fear of falling, that you really start to investigate it with your health care providers.
It's very important for you to make those visits to engage with your healthcare provider, because one of the things you kind of see in older adults is the amount of medical issues starts to rise, and with that is the amount of medications they're taking. And those medications, I tell everyone, every medication you take has a side effect, it has an adverse reaction. And so when you're starting to see falls, you really want to make an appointment to talk to your physician. One of the things that we're blessed with in geriatrics is that we are able to spend a lot of time to go into and look at what medications could be causing those things. We also partner with pharmacists who can also spend those time to look at adverse reactions that could occur from those medications. And sort of kind of one of the key words they talk about in geriatrics now is de-prescribing. So cutting back on a lot of medication. Less is better. So,
and that's really a change. I was having that conversation with somebody today about how we seem as a society that we have so little tolerance for any pain that even when we have a major medical procedure, we expect there to be zero pain.
Yes.
And because there's been so many prescriptions available, but with those, as you said, come a lot of risks, a lot of adverse effects, which could include falling, I would imagine, because some will make you dizzy or lose, sense of balance or something like that. So let's talk, and I'll let whoever wants to, what are some of the risk factors? Talk about them, and what ones can we change? What can we deal with?
I can go first.
yeah.
I just want to clarify one more thing about what is a fall. Getting up from a chair or a bed and falling back onto it is also considered a fall.
See, that's important. Because unless you're doing it for a comedic effect.
Exactly.
Right, and I think that not knowing that, sometimes people don't recognize that
Because
that's
they
a fall.
haven't hit the ground.
Yes.
Right.
Yeah.
So if their fall is broken by something, but they still didn't intend to do that,
Yep.
it's still a fall.
Yep,
Okay.
exactly.
Yeah.
So risk factors for fall are, as Dr. Thomas mentioned, as we get older, there is increased risk of falling because, one thing, there's changes in the body function and physiology as we get older, but also because there's more likelihood that you're going to have medical conditions that make it more likely that you're going to be on the medicines that will cause that. So age can be a risk factor, which is not modifiable. But medical conditions and medications, those are certainly things that can be modified, and there's nuances to how older adults should be treated with people who have diabetes and hypertension. They may have been treated a certain way in their 30s, 40s, and 50s, but getting into their 60s, 70s, and 80s, we have to be a little bit more careful about how tightly we control those conditions, because too tight a control can lead to falls, and that's not always something people are aware of, because they like, for example, with diabetes, they've kind of grown up with their doctors with the mantra, and your A1C needs to be close to 6 or even less than 6, which is a number that they measure to see how the average sugar has been for the last 3 months, and it needs to be at a certain level when you're younger, but as you get older, that becomes a little bit more liberal. So there are modifiable things that can happen with disease management and medication management that we can work on. There are risks within the home that people aren't aware of, like, rugs, which we all love our area rugs. Some of us anyway, not this one.
It's true, because when we go into the homes, because one of the things we're blessed with is when we do home visits in some part of our practice. And one of the things we do is every time we go into the home, we do a home assessment. We're looking for rugs. We're looking for is the hallway well leaded? Because again, those things are trip hazards. And at this age, when you fall, I tell my patients, like, you fall, it's not you dust yourself up and you get up and you start running. It's with consequences. You could break a hip. You could have a brain bleed, which could kill you spontaneously, or it could incapacitate you, and eventually you could end up with a more decreased level of function that could potentially lead to more institutionalization, assisted living, or nursing home.
And frequently they can't get up on their own, and they may or may not have somebody else in the home who can help them. Either they may be on their own, or they've got a partner who is also older and isn't able to do that. Let me just ask a real quick question. At what age do people start coming to a geriatric practice? Typically, or what is
Typical.
Right.
Typical, so we kind of, the typical age is when Medicare kicks in.
Okay.
Yeah.
So that's 65 and above,
Okay.
typically.
Right.
But there are people who are younger who have conditions that make them behave like people who are older.
Okay.
We talk about kind of functional age as well as just chronological age. So.
And also the other thing is also with a geriatrician, because we also deal with a lot of people with cognitive impairment, and we've been trained to deal with a lot of people with dementias, and unfortunately you may have some people who have the early onset, so they may also come and see us.
Okay.
But I always tell everyone, I said, even if you are 65 and older and you're healthy and you will benefit from a geriatric assessment because it allows us to set up a baseline, but also to catch things sooner so that it's not down the road where then we're sort of making that transition of getting into an institutionalization situation. Whereas if we had made those changes, you can still continue to function and live within the community.
So Holly, let's talk a little bit about other things that can help. So rugs, I think, are one of the most common ones we look at. But what about exercise and other changes to the environment? What kind of things do you help look at to keep people out of the ER?
Sure, and those are huge, and I think that's the other risk factor is what behaviors are you engaging in or not engaging in. And so exercise, as you mentioned, is one of the biggest things that we can do to reduce our falls risk. If I lead a sedentary life and I don't get out of my house all that much, I'm going to start to weaken. I'm going to lose my sense of balance. I'm going to lose my gait. I'm going to lose my muscle strength. And all of those things are going to lead to an increased fall risk. But if I can get as little as 8 hours of exercise a week, that helps me build muscles. Those muscles are going to help prevent falls, and they're going to help me recover from the fall a lot better than not being in decent physical shape.
And that's got to be one of those vicious circles, whatever the saying is, because if you have a fear of falling, sometimes you don't want to get it because the idea of more movement is intimidating and you fear that, but then it's just making it worse because your muscles aren't being used.
Exactly.
And
Yeah.
so
Right.
how do you help
increased
people?
fear of falling is itself a risk factor.
A major one.
Yeah.
I
A
would
major
imagine.
one.
Yeah.
Yes.
And then here we are in Michigan where we have 130 months of winter.
So,
and
yeah.
but it's coming and I'm not looking forward to it, but
Where our patients still show up even when the weather is bad. And we're saying, oh no, stay at home, it's okay.
Yeah. But also I think it's important to, when you bring up winter, that's always important that when we think about exercises, you want to think about a structured and a longitudinal thing. Because again, our older adults, as they get older, friends are more going up to the south for winters. Your world starts to get narrower and narrower. So it's nice to have something which is longitudinal, it's structured, and it gives you something to look forward to and go to. So I always encourage my patients to kind of look at different opportunities like silver sneakers, walking around the mall, also maybe joining Planet Fitness or some exercise program. And I always encourage them to do it with a friend or a partner because it's usually scary when you're doing something new by yourself.
that doesn't matter what age you are.
Yeah.
But there's a lot of things that are building at Tanglewood Park that
Yes,
absolutely.
offer that are in a variety of
Yes.
seated things for people that have those kind of issues, and then there are a lot of fall prevention
Yeah.
classes and
Yeah.
things that are offered for.
But that's usually a fear because a lot of people are like, I'm not used to doing something by myself and now you're telling me to go and do that. But when they have someone else who partners with that, it is a lot easier to kind of face those.
The buddy system.
Yeah,
always
the buddy
works
system,
really well
yeah,
for those
yeah.
kind of things. So let's talk, Holly, and I'm going to switch things around from what we've talked about. Let's talk about that event you have coming up later in the month. You have a fall prevention open house. Tell us
We
about
do,
that.
on Friday, September 27th, from 1 to 3 at the Mercy Health Pavilion, which is where the geriatrics practice is. We have an open house, and we've gathered all of the resources that address health issues for older adults to come in and be sort of like a one-stop shop. So we've got Baker College's OT, Occupational Therapist Assistant Program is going to come in and do falls risk screening. Public Health is going to come in with a medication lockbox program that they've just launched. Our pharmacy program at Mercy Health is going to come in and do some med screenings for people because, like we said, that's a really important piece of it. And I think one of the issues there is that we have people that use multiple pharmacies,
Yes.
and that can be really dangerous because then your pharmacist isn't able to screen. We're also going to be featuring Car Fit, which is making sure that your vehicle is fit properly for yourself so you're as safe as you can be when you're traveling. And we also recently launched a Yellow Dot program with Norton Shores Police Department, and what that does is it provides emergency medical information, allergies, contact information. In the event of a crash, that information's in the glove box, and first responders can grab that So if something happens and a driver crashes into a tree, they might be able to go grab that yellow dot card and find out this person is a diabetic, and maybe we're looking at issues related to that rather than it being just we
fall.
crash. So all of that stuff will be available there. You can stop in at any time, and we're also going to be signing people up for those car fit inspections, and we'll be signing people up for our Matter of Balance class there.
Okay, great. Well, that sounds like really good information. Tell us a little bit about Matter of Balance. We offer that through Senior Resources periodically. Tell our viewers
Sure.
what's involved in that, because it's a really great evidence-based class
It is.
series. And as you said,
It is.
time over several weeks, you get some great tips. Let's talk about that a little bit.
Yeah, so it really a good piggyback into talking about the fear of falling. The Matter of Balance, it starts with that concern, and in fact, that is a major focus of it. So I think what happens when we get older, we kind of compartmentalize, and we don't want to talk about those things that we're really afraid of because we're so afraid we're going to lose our independence. And what Matter of Balance does is it puts you together in a small group. We never have more than 16 people in that group. And we really talk about, what am I afraid of? What have I stopped doing? So, we have people that come in and say, well, I used to love to go to the movies, but I don't go to the movies anymore because it's dark in there and I can't see well enough to feel comfortable walking to my seat. And then the group strategizes with them, which is fantastic because here's a group of people that have the same or similar fears, and it's easier to solve somebody else's problem than it is to solve your own problem, right? And so you have this whole group. And one of the things we're talking about, the exercise, I've had several of my Matter of Balance groups actually continue to meet after the 8 sessions are over, and one of them said, we want to continue to be active, and so they tried new things every month. So they went line dancing, they went swimming, they did all of these different
So they
things.
become almost like a little support.
It is. It really is.
Awesome.
It really is. So they're fantastic classes. I can't recommend participation enough. We do it totally free. Mercy Health sponsors the class, so there's no cost to participating. It's anonymous. I don't go running back to your doctor and say, "Did you know?"
No.
3 times.
That's right. No, we don't do that. But we talk through, kind of dealing with that fear and taking hold of that fear and conquering the fear in ways that are safe and appropriate for you. And then we also move into some physical exercise. So we want to build your balance and we want to build your strength. And what happens is you get a booklet that gives you this exercise regimen that you can continue to do when you're done with class. And that often is a stepping stone to getting involved in some of the other things that are available in the community, like Silver Sneakers, like the classes that are over at the Tanglewood Park.
So we're dealing with the physical, certainly. We're dealing with the mental about the fear, and then the social as well
Absolutely.
out of that.
Yeah.
So
One of the things I also like about the program is it kind of talks about, fall prevention is not 100%. So I think one of the things that you talk about is how to deal with
Yes.
falling and what to do when that happens, or
Yes.
how to fall in a way, and then how to get up from that.
How to get up.
let's talk about that. That's a great segue into another question. How do you do some of that? If you've fallen and nothing's broken and you can kind of sense, are there safer ways to get up? It seems like as we're younger, we just, as you said, we just hop up generally.
Yeah.
More times than not, people are going to need the support of both their hands and legs, arms and legs, to get up, and so they're going to want to kind of scooch themselves over to somewhere where they can grab onto something and get up that way.
Or if somebody's with them, they should ask them maybe to move a chair or something.
Yes, that would be closer. I don't recommend somebody asking a person, especially when you talked about earlier, like they're living with somebody else who's also frail, that person be the one to pick them up off the
Now
floor.
they've got back problems.
So we don't want to do things like that, but I think asking for help to move somebody, and if you can't do that, it's okay. We do have emergency support services within the community that people can frequently call, and that's what they do. They just come and help you get up again.
But also, actually, picking back off of that, one of the things we also start to, when a patient comes in for evaluation with us, is we start to kind of look at them and say, hey, we are concerned about maybe you might be falling, you might fall or something like that. So we actually talk to them about getting Life Alert bracelets or necklaces. A lot of our patients, we highly encourage it because, again, if you fall, if something happens, you can easily press that button because you still have to get up to try to get help, to call, dial the number and stuff like that. So if you have a Life Alert bracelet or a necklace, you can push the button. And I always tell people, I'm like, I have patients who would get those Life Alert bracelets or necklace, but then would not wear it and put it by the side of their bed. So I usually tell people, I'm like, even when you're in bed, you want to wear it, because at night, people get out of bed to go to the bathroom, you fall.
Poor light.
A lot of, yeah, and a lot of those also are waterproof. So when you're in the bathroom and you're showering,
Which
that's
is a huge risk factor.
Exactly.
Right there.
Right.
So you could still be able to push that button, because that way they can come in and help you.
And they don't always, because I've experienced this personally with family members, that there's sometimes a concern, well, sometimes people are going to be concerned about the cost of an emergency visit, of the ambulance or the fire or whatever coming, but if you call and you can talk and it's not an emergency and you say, I've fallen, I just need help, they don't necessarily have to come lights and sirens, right? Because sometimes there's that embarrassment factor.
Not at all.
Yeah, and I always remind my patients, I'm like, I get it, because a lot of our patients are on their fixed income. But I also tell them, what is the value of your life? Your life is priceless. We can always deal with the financial ramification later. But if you're not here,
Yeah.
So that's priority.
So what if we've got loved ones watching and they're maybe not they're young like we all are, and they've got parents or family members, though, what kind of things should they be looking for where they might want to say, okay, mom or dad or aunt or uncle, we need to think about getting you into the geriatricians, because is there one fall is probably not necessarily a big deal, but is there a frequency level, or is there
I would say one fall is already one too many.
Okay.
So if they're having that, I think you should have them come in to see a geriatrician, because again, we will start to kind of look at geriatrics. One of the things we do is we approach the person from head to toe. Say, look at it. Is there a memory issue? Is there an issue with medication? Is there a nutritional issue? Because again, people live on that fixed income. Exactly, and you're losing muscle. When you lose, I tell my patients when they're like, oh, I'm so glad I'm losing weight. I'm like, no. I know you've heard all your life about weight loss. And weight loss, you want to lose weight and stuff like that. I'm like, at older adults, I don't want you losing too much weight, because when you're losing weight, you're losing muscle. You're not losing fat. And when you lose muscle, that could be functional loss, because when you get sick, it becomes more challenging and more difficult for you to recover.
Yeah. I think, children visiting parents, and this is a very kind of tricky situation, because the fear of falling is not just about the fall itself, it's the outcomes of what can happen. And there, like you mentioned earlier, the loss of independence. And so as children, it's hard to navigate that, and you have to be kind of careful. You don't want to step on your parents' toes, and they are still autonomous individuals who can make decisions for themselves. So it really has to be a partnership, and it's really, mom, dad, if you did this, it would help me feel more comfortable.
Yes.
Could be a way to approach it.
I think a lot of times you do have to go at that with the how it will help your life, because it's very difficult. I see it in lots of different things, and I've experienced it personally and seen it many times, where when that parent-child thing
Dynamics
reverses
change,
a little bit, and now it's a very hard. It's hard for both people, but it's certainly hard for the older adult to be like, wait, no, I'm the parent.
Yes,
you don't
you're
tell
not
me.
parenting me.
And it's hard for the kid to be in a situation of no, but
Yeah.
I don't want to have to do that, but sometimes you're thrown into it, and you need to.
Yeah. And like Dr. Thomas said, one fall is more than enough, because one fall is a risk for another fall.
Yes.
And so I think anybody over the age of 65 could benefit from a geriatric consultation and prevent future things from happening beforehand.
And I would also even add to that in the sense of, navigating the issue with your parents. Sometimes it is also kind of maybe broaching it and saying, I'm interested, I know you're getting older, I would like to learn a little bit more about what's going on with you health-wise. So sometimes inviting yourself to their doctor's visit opens the door a little bit for you to be able to start to ask questions and express concerns. Again, it's always important to approach it in a collaborative sense, because you want the buy-in.
Right. So we just have probably less than 5 minutes left, so I'm going to go to each one of you and ask you if you had one piece of advice to leave with our viewers, what would it be? Holly?
Wow, that's a tough one to just narrow it down to one. But for me, it's move. Just keep moving, keep active, keep exercising, and it doesn't matter how little you start. If all you can do is manage to do push-ups out of your chair, that's okay. That's a starting place, and next week you'll do 2 instead of 1, and you'll keep on building on that. But just keep moving, because once you stop, it's really hard to gain that back. It is.
Downhill
It
slide
is.
potentially there. Dr. Thomas?
I would also add to that, also I think one of the things we didn't touch on is using assisted device,
Oh, yes.
walkers and canes. A lot of people go, I don't really want to use that,
They're
but
afraid
guess
it makes
what?
them look old.
Yes, but guess what? It's something that could help you with your balance and stuff. So I always encourage my patient to think of it as their third leg. So if you're moving, it should be in your hand, or it should, for
I've
you
seen
to.
some pretty cool blinged out
Oh, yeah.
walkers.
Oh, yeah.
As well.
I saw a jazzed up cane today. It was pretty good.
I actually have a patient who has a cane for every occasion.
Oh, wow.
It was
funny.
wow. It was like, it's
Just to add to that, I usually try to reframe the perspective of looking at assistive devices. It's not about you looking like you're disabled. It's keeping you more able.
Yeah.
That's one thing. But my other big thing that I warn patients about is over-the-counter medications are not benign. They're not necessarily safe. And there are many of them that are on the counters, on the shelves out there that are approved to be over-the-counter that can lead to falls without people realizing that that's what's doing it. And until we dig and find out, we don't realize that that's what's happening. And so be cautious about buying over-the-counter medications, and always, always, always tell your doctor when you do.
So, I was going to say, the conversation when you go with a med list needs to also include
Yes.
over-the-counter
Over-the-counter
things as
medication.
well, because there can be interactions there
Yes.
as well.
Yeah, and one big one is the Tylenol PM. It's got Benadryl in it, and Benadryl is one of those medications that is a huge risk factor for fall in older
Absolutely.
adults.
Good to know.
So I always tell patients, but they're like, oh, I'm just taking a Tylenol PM, it's helping me sleep. Well, it's
Which
also,
is, but if then you have to get up, which we'd have to do more frequently,
Yeah.
that would be a whole other show too
Yes.
about
Yes.
We could do a whole show on that one.
just need to come back every month. So let's talk, though, we've got about a minute and a half left. One more reminder to our viewers about the open house coming up.
Yep, we will be at Mercy Health Pavilion next to the Geriatrics
Which is on
office.
Sherman.
On Sherman, next to the hospital, September 27th. It's a Friday from 1 to 3.
Okay. And no cost to come. There's
No
lots
cost.
of great information. They can sign up, find out about the upcoming Matter of Balance classes. They're going to get the car fit. So, because I would imagine part of that, and I know we've done shows before on driving, you want to make sure your seat is the appropriate, that you
Yep.
can see out. You have just visual little old ladies peering out.
Oh, yeah.
And there are adaptive devices for vehicles, too, which a lot of people don't realize.
Well, we're going to
Yeah.
have, boy, I
Yeah.
think you guys have just planned out
Yeah.
my whole next
Yes,
year's worth of
exactly.
shows.
Yeah.
Really.
Yeah.
Everybody else.
yes.
All right. Well, they just told me I have 30 seconds left. So thank you so much, ladies. This half hour flew by, full of good information. I seriously will have you all back on here. So again, you can find out more about that. You can call Mercy. You can call Senior Resources. Our obstetrics counselors know. And of course, if you can't remember that, you can always dial 211 24 hours a day, 7 days a week, and they know all kinds of fabulous things that are going on. Thank you, ladies, for coming and joining me, giving us great information. Thank you for watching us. And remember, many falls are preventable. Move, watch your meds, use assistive devices. Thanks for joining us.
Thanks. Ooh, yeah, that went by. Yeah, sure. We have to. Yeah, we're ready. Just talk to. Yeah. Geriatrics. Yeah. Yeah.